Hi, Dr. Tammy here. I'm going to share with you how to interpret your lab results that you've had for Better Living RX. So, the first thing that I want to tell you about your test results is that I want you to think of this as a roadmap. And I think of these test results in two different ways. One is what we call static, and one is dynamic. The static is just one picture in time. So, the first time you've had all these extensive lab results done, you will have just a picture of what's going on right now. Now, remember that you may not be feeling well, things may be out of balance, and so everything's going to change depending on how we manage things. Also, if you like start hormones, especially bioidentical hormones, as these things change, everyone's body is different. And how they convert hormones and what they do with them gives us this dynamic picture over time, or this changing picture over time. And so it's very important that we know what your lab tests do over time. So we'll have some follow-up videos to talk about what those might look like. But this is just one picture in time, and how you make your roadmap for feeling better, getting your hormones balanced, getting your nutrition under control, or your genetics, or whatever that looks like. This is just one picture in time. So as we move forward, I just want you to keep that in mind. And there's a worksheet that goes along with this. So you'll want to follow along on your worksheet as well. And the worksheet is exactly this presentation that I'm giving. And when you get your lab results, you'll want to use that worksheet to fill in the blanks to the worksheet so that you can understand things. So, the main things that we test for in Better Living RX in our biobalance system are hormones and nutrients. And I always say that the blood doesn't lie. So, this is an indicator of what's going on with your hormones and nutrition. And what makes our program unique is that over the years, I've developed a system for getting these hormones in balance and getting the nutrition up to par. So that is this first step that you're taking in understanding these things. Now, there's many other things that we can test for, and your coach may refer you for some different testing, or your provider may refer you for some different testing. But the beauty is that once you handle just these two areas of the biobalance system. Of course, there's also fitness, stress, and detoxification, but hormones and nutrition are a huge part of that. So understanding that is critical, and so that's what we're going to move through as we talk about this. Now, I want to talk about hormones just for a minute and talk about the symphony, if you will. If you can imagine a symphony or a band, all of the hormones interact with each other, just like if you had a symphony playing. So let's imagine for a minute you're listening to the symphony and it sounds wonderful. But what if one of the violins started playing out of key? The whole show would sound terrible, right? So that's kind of how your hormones work. And when you have one system that's out of whack, the other systems quickly go out of whack too, because if someone's playing off or off key, or at the wrong tempo, then unless you've got a director who can pull that all back together, everything starts to get unbalanced. And what we often see, especially after menopause, which is the majority of our patients, is that in men, when the testes start to not make as much testosterone, or in women, the ovaries start to self-destruct, if you will, through the menopausal process, then we start to see these decline in hormones. Now, the beautiful thing is we have these little things called adrenal glands that sit on top of the kidneys, and they can make all the same hormones that your ovaries or testes do. So if you are healthy, if you have low stress and the adrenal glands are not fatigued and they're working properly, even after menopause, or what we call andropause for the men, when their testosterone starts to decline, the adrenal glands should compensate. But what happens is we have all these different stressors, and so the adrenal glands don't. One of the next things that starts to go after the adrenal glands is the thyroid. And so what we'll see is, since the thyroid regulates your metabolism, we'll see all sorts of problems with weight gain, and all the things that the thyroid regulates, like your digestion and your sleep. And so we start to really have challenges that way. And what brings a lot of people to our program is weight gain. And although we're not known as a weight loss program, you have to get healthy to lose weight, we do address these issues, because when all these hormones start to get out of balance, makes it much harder to regulate your metabolism and to regulate your weight. And we all know that especially belly fat, which is upregulated by cortisol in your adrenal glands, I'll talk about that a little bit more in a minute, is the most dangerous fat. And so when you start to have more belly fat, we start to see more disease processes. We start to see more heart disease and high blood pressure and all sorts of issues that come about. So getting the body into perfect alignment really is critical to have hormones balanced. And then in the brain, up here in the head, we have the pituitary gland. And the pituitary gland is the feedback that tells all the other glands how much hormone to make. And so there's something called the HPA axis, which speaks to all the other glands and tells them that they're in balance or not in balance. Another thing is all the carrier proteins that regulate all your hormones are regulated by all the other adrenal or all the other endocrine organs. And so what we'll see is we'll see the free available hormone to your body go down because these carrier proteins get upregulated or downregulated. So that's just kind of an overview of the hormone processes that we look at. And also we'll look at the pancreas here, which makes two different things. It makes your insulin, which helps regulate your sugar metabolism, and it also makes what we call exocrine or digestive enzymes. So if it's compromised in any way, your digestion may be compromised as well. And so oftentimes we'll put people on digestive enzymes for that reason. So I want to talk first about the adrenal glands. And like I say, these are one of the first glands to go when the other hormones are out of balance. But the reason I'm talking about that first is because what we perceive as stress is so big in our society, and that can be emotional stress. It can be stress from our food sensitivities or food allergies or a leaky gut or not digesting well. And so what happens is cortisol can be either elevated or decreased, and we want it kind of sort of in the middle. And sometimes we will recommend that you do serial cortisol levels, and so usually this is done through a saliva test where we do it first thing in the morning, mid-morning, afternoon, and evening, and we can get a better indicator of what your cortisol is doing throughout the day. And I have a whole protocol on adrenal fatigue, so if you have issues, you'll want to refer to that protocol. But if you look at your cortisol levels, and if you look on your lab test, you can fill in the blank, my cortisol level is. And usually we check cortisol levels in the morning when our lab techs are available through a blood test. And the range can be anywhere from about 6 to 20. And so you'll want to look, and if you were to draw a bell curve is sort of just a mathematician's way at looking at all the different people who have submitted what we call normal ranges. And where you fall on that is if you fall on the low end, we call that low. If you fall on the high end, we call that high. And if you're right in the middle, we're going to call that normal. Now, again, this is just a static picture in time. It's just one cortisol level, but it really kind of gives us an indicator at that picture in time how you're doing. And so if your cortisol is low, then we may, if it's really low, we may recommend some natural hydrocortisone or cortisol, which is a bioidentical form of cortisol that we can give you in your hormones. And usually we'll do that for a few months to allow the glands to recover. And sometimes we'll do that with the thyroid gland as well. If it's just borderline low, we may just give you a little thyroid hormone for a few months to allow the gland to recover and start making hormone on its own while we're addressing emotional stress or addressing the other things in the biobalance system, your nutrition, your fitness, all those other areas as well. A lot of times when people are adrenally fatigued or the glands are wiped out, people will have low cortisol levels because they've probably been high for a long time and now the gland is just tired or fatigued and it's not making enough to keep up. Cortisol is your body's natural anti-inflammatory. So if you don't have enough cortisol, you're going to have inflammation in the body. And this could show up as joint pains or the more scary thing is inflammation in your arteries, which can lead to heart disease or brain disease like dementia. So we want to keep the cortisol levels regulated. Another thing is emotional stress. So if you've been through a lot of emotional stress, we have ways that we can help you with that as well. But we really want to deal with the emotional stress because your body doesn't know the difference between being chased by a bear or, just kind of the can't pay your electric bill. So if you're stressed all the time, it's basically like your body has upregulated these hormones to allow you to what we call fight or flight, to deal with stress. And over time, when you have high levels of cortisol, it can literally affect all the other endocrine system, and it can start to kind of melt the brain, your prefrontal cortex, which is your thought processing center. And so you'll get brain fog, and you'll just have memory issues, which can lead to dementia, which is a little bit more scary. And again, I just want to say throughout this that I'm not trying to scare you. I'm just trying to tell you what can happen if these things aren't balanced and in balance, basically. So you might be recommended, if your cortisol level is high or low, some adrenal support therapy. I love Metagenics. There's a product called Adrenogen that helps regulate the adrenals and cortisol. It's absolutely fabulous. It has a little bit of desiccated adrenal gland in it, and I'll usually ask people to take that. There's a reference to a link that you can order from them, and they're absolutely a wonderful company. They are a medical grade supplement company, so you have to have a medical license to order from them. Our practitioner code is TTucker, TTUCKER, and you have to put that in to order from them, but that's very easy to do. Sometimes we'll use bioidentical cortisol if it's very low. We may even put the cortisol in your bioidentical female or male hormone therapy, which is an easy thing to do. And then if you're really fatigued and your cortisol is very low, we may use a separate, what we call Cortef, is a prescription cortisol. And it's not like prednisone. If you've ever been on prednisone, that is a synthetic form of cortisone that is very hard on the body. It causes a lot of fluid retention. It causes the insulin to get unbalanced, and so it'll make you crave sugar. If you've ever had a cortisone shot from the doctor for your joints, the side effects can be not sleeping or irritability. So this is a very natural way to support the adrenals. We will want to recheck your lab test after about 3 to 6 months to make sure that if we're doing a specific therapy, that it's correcting out. And we don't want to leave you on cortisol forever if we're doing a prescription cortisol, because we don't want to have the adrenal glands get lazy. We want them to keep functioning. So that's something that we'll follow along with you. And then your provider may recommend other tests if your cortisol is very high or very low. If your cortisol is very high, we need to look at emotional stress, what's going on in your life. And then we also need to look at food sensitivities, because the foods that cause inflammation in your body, if you're eating a lot of those, it will cause upregulation of cortisol, which then leads to belly fat, which is protective, but it can be a problem over time. So stress hormones are triggered by emotional stress, physical or chemical stress. And the food sensitivity testing can help us identify the foods that are triggering a lot of inflammation or stress on the body. And, basically, we can look and see if you're in adrenal fatigue, and then we can make very specific supplement recommendations as well. Cortisol is not the only indicator of adrenal function, and also cortisol is made by the ovaries and the testes in males and females. So if you're not menopausal or andropausal, we call that in men, then you should have normal cortisol levels. A lot of times in midlife, when we start to have those compromises in male and female hormones, then we'll see compromises in cortisol as well. And we hope the adrenal glands keep up, but sometimes they don't. And I'll say, sometimes I'll have patients tell me, well, my mom or my grandma got through menopause just fine. And usually that's because the adrenal glands weren't too stressed and they could compensate for all those other hormones. But the cortisol and the DHEA are a good adrenal indicator of adrenal function. So when people are thinking about losing weight and they're thinking about cortisol, I always let people know that you don't lose weight to get healthy. That's a myth. You actually get healthy to lose weight. And most people, as they're trying to go on a weight loss program or trying to lose weight, which is what's beautiful about what we do, is we actually address the healing phase. So for the first few weeks, and this is time in weeks on the bottom, and this is weight in pounds on the left axis. For the first 2 weeks, really you're just losing fluid when you're going through a weight loss program, or when you're just healing and getting things balanced. And so some people will lose a few pounds in the beginning, but then they'll lose a few pounds, but then it kind of plateaus out. And the reason that plateaus out is because that's usually just fluid loss that you're losing in the beginning. And this healing phase can last anywhere from 4 to 6 weeks. So if you're in our program, we really tell people not to think aggressively on losing weight because the healing phase takes time. And that's the beauty of our program. It's not a quick fix. We don't take weight loss pills and just, don't change anything else. We really heal the body. And when you go through your detox phase, which is 21 days, we'll clean up your eating and we'll deal with your hormones. And so we're really looking at this healing phase. And then once you get through that at about 6 weeks, the actual fat burning starts to occur here. And so the real weight loss, say you're 200 pounds and you want to be down to 180 or wherever, the real weight loss starts to happen when you're healthy. So, what is belly fat? Well, I used to wonder when I had patients who were overweight why they didn't have heart disease or kidney disease or lung disease, high blood pressure or diabetes. And the truth is the reason is because that belly fat is upregulated by cortisol to protect you. So that belly fat pulls away all your toxins, your abnormal hormone levels, and the things that you eat, the toxins in your environment, and it protects you to keep you from getting sick, but that's only a temporary fix. People who are overweight eventually do get heart disease and sick and all the other issues that come. So you can love your belly fat because it's protective, but the only way to really get rid of belly fat is, like I say, through this healing phase and getting hormones in balance and getting your cortisol in balance so that when your body doesn't have all the toxin exposure and all the stress exposure, then it can actually start to lose weight in a healthy way. So I mentioned that DHEA is another indicator of adrenal function, and so you can write in your DHEA level here, and the range is anywhere from 30 to 700. And if your DHEA is normal, that's great. Normal would be probably between 5 and 600. I very rarely ever see a normal DHEA level, especially in the people that come to this program, unless you're doing a proactive program, which means you're pretty healthy. You're just trying to uh, get into anti-aging or biohacking or things like that. But most people have a very low DHEA. And so a lot of recommendations that we'll make are to do the prescription bioidentical hormone therapy. We'll add DHEA. You can take oral DHEA. You can even get oral DHEA over the counter. The problem is a lot of the supplements that you get out there on the market, you just don't know what you're getting. There's not a lot of regulation on supplements. And so the way that, what you're getting and the way your body converts those supplement DHEAs in the amounts are a little unpredictable. So I would prefer that you get your DHEA in the prescription therapy so we know the quality and we know how much you're getting. If your DHEA is low, then we may recommend some other testing. Very rarely is DHEA high. Occasionally we'll see this in conditions like polycystic ovarian syndrome, but it's very rare to be high. Usually it's going to be low when the adrenals are compromised. So I just want to mention how hormones are made in your body. They all come from the sex steroid hormones anyway, come from the cholesterol molecule, which then turns into pregnenolone, which then turns into progesterone, which can go to cortisol in both the ovaries or testes or adrenal glands. So this is one of the reasons why cortisol is so important, because if cortisol is unbalanced, then your estrogens and your testosterones are going to be unbalanced as well. So in the next section, we're going to move into the sex steroid hormones. And I want to just kind of show you here the blow up of the estrogens. And estrogens are usually 3 different kinds of estrogen. We call that E1, E2, and E3. And E1 is the problematic estrogen that causes something called estrogen dominance, which causes weight gain in the hips. It can cause abnormal bleeding if you're still having periods. It can cause breast cancer if it's too high. The estrogen receptor positive cancers are problematic for this proliferative estrogen. And it can cause prostate cancer in men because, again, men and women have all the same hormones. So when men take testosterone, if it all converts to estrone, that's a problem for prostate cancer. Or if a woman takes estrogen and it converts to estrone, that's a problem. So as we look at your levels, a lot of menopausal women are very low on all their estrogens. And as we give them estradiol and estriol, which is E3 or the protective one, estradiol can convert a little bit to estrone. So again, that's where the static and dynamic comes into play. you may be statically low on everything right now, and as we give you some estradiol, some people are prone to convert more to estrone than other people, which is the reason that some people are more prone to breast cancer or prostate cancer than other people, as well as your genetics kind of dictate how fast you convert to estrone. So we'll want to follow these estrone levels. And I want to show you that the arrows go both ways between estradiol and estrone. The arrows only go one way to estriol. So if we give you bioidentical E3, we can give you that all day long and not worry about it converting back to estrone, which is great for people who've had breast cancer or a family history of breast cancer. We feel completely safe with estriol. And most traditional doctors don't know about the different estrogens, or maybe they learned it in biology 100 years ago, but they don't know the applicability. So the beauty of bioidentical hormones is that we can choose to use E2 and E3, not use E1, and we can monitor levels of E1 in both men and women to see if this is going to be a problem at all. Whether we're giving a man testosterone or we're giving a woman estrogen, we can really monitor these levels and make sure that we're doing it safely. So the different estrogens, E1 is estrone, which is the proliferative. I hate to use the word bad. God doesn't make a bad hormone, but when it's unbalanced, it can cause estrogen dominance and problems. E2 is estradiol, or the neutral one. And the thing with E2 is that it's really the best for hot flashes or for building bone density, for memory, all those things. And E3 is completely protective. Pregnant women have a lot of E3, and that's one of the reasons that you rarely ever hear of a pregnant woman getting um, breast cancer, because it is so protective. And in women, the estrogens vary according to age, and if they're having menstrual cycles, it may vary during the cycle. So it's important that if you're still having menstrual cycles, that we know that, so that we can see where you're at in your cycle to see where your levels are at. And hormone levels are also changed with taking birth control pills or estrogen replacement therapy or synthetic therapy like Premarin and things like that. So you want to keep that in mind if you're on any of those things, and make sure to let your provider know. So what are the good things of estrogen? Well, estrogen helps to maintain the body temperature. So when you get the hot flashes, that's, if you're low on estrogen, then you get the hot flashes, and those can be miserable, or the night sweats. And it also helps against memory loss. So dementia is much more common as estrogen levels decline with people who are, I don't even like to use the term aging. Aging is just hormone decline, because all of these things we think about aging are hormone decline. It helps the breast to stimulate development at puberty. And if you have too much estrone, or the proliferative type of estrogen, can lead to proliferation, which can then lead to tumor, which can then lead to cancer. So we don't want that. So we want the right balance. And it helps moms, make milk for babies. Estrogen also helps the heart and liver, and it regulates your production of cholesterol. Remember, I showed you in the graph that cholesterol turns into estrogen. So it can also decrease the buildup of plaque in the coronary arteries. And I won't even go into the discussion about the study in 2002 where women were using synthetic estrogens that were actually causing heart attacks and strokes. But natural estrogen can help regulate your cholesterol levels and the inflammation in the arteries as well. Estrogen also helps with menstrual cycles, and if you have too much, it can cause heavy menstrual cycles, so the balance is very important. It can also help if you're trying to, with a baby, get pregnant, and it develops the uterus tissue for the baby. It helps bone density, so a lot of times we'll see with declining estrogen, we'll see hip fractures or, bone fractures, and this can happen in men as well, so men can get thin bones as they age. Estrogen also helps keep the vaginal lubrication and can help with vaginal dryness or painful intercourse. So very important to keep the vaginal tissues estrogenized. Also, we'll start to see urinary tract infections and incontinence when the vaginal tissues lose their estrogen, because they lose their elasticity. So it can help with all of those things. So whether you're a male or female, we check estradiol levels because of the conversion from testosterone. If you're a man, and a woman, it's essential for healthy tissues and bones and brain. So if you could write in your estradiol level there now. And the reference ranges are basically, if you are a menopausal female, we want the estradiol to be 60 to 80. And then depending on if you're menstruating, your provider can talk about those different levels with you in different phases of your cycle. And if you're a male, we don't want your estradiol level to be more than 30, but men do need about 20 to 30 estradiol just to help with their bone density and mood regulation and, to keep them balanced. Estrone is the problematic one, and you can write in your estrone level here. Optimal is less than 30. Some statistics say even up to 50, but if it's higher than 30, we usually recommend some kind of estrogen blocker. I like to use the natural estrogen blockers like DIM or diethylmendolamine, and you can get this through Metagenics. I love their preparation, and it also has methylfolate in it to help regulate the liver estrogen conversion as well. But you might also hear it called IC3, which has 3 different carbanols in it, and DIM is just one of the carbanols. So if you get IC3, you're actually getting DIM plus, basically. DIM is found in green leafy vegetables, and so people who eat a lot of green leafy vegetables or cruciferous vegetables get a lot of DIM, which can block the estrone, which is a problem for estrogen dominance all the way to cancer. And I usually recommend about 2 tablets a day of DIM if you have an elevated estrone level. If it's very elevated, then we might even do some prescription estrogen blockers. Testosterone, we usually check free and total. Free just means it's available in the blood. Total is all that's there, bound or unbound to the carrier proteins, so like little cars that carry your hormones around. And you can write in your testosterone level now. And for a female, the total testosterone is usually from 8 to 48, and most women feel good at about 30 to 40. For men, the reference range is 200 to 1200. Most men feel good at about 800 to 1100. So that's the recommendation that we'll make. We might put some testosterone in your bioidentical hormone therapy to get those testosterone levels up. Testosterone is not just about libido or sex drive. Testosterone can help with muscle stamina and building muscle. A lot of times with the aging process or the decline in testosterone, we'll see decreased muscles, we'll see more fat deposition, and we'll see high cholesterol and all sorts of problems that come from low testosterone, as well as fatigue. If you're just tired and you don't have much stamina or tolerance for exercise and you don't have much muscle, you're just going to be tireder all the time. Testosterone is commonly known as the male sex hormone, but both men and women have it, and it's made from the testicles and the ovaries and the adrenal glands. And in men, low testosterone can, we call this male hypogonadism, and it can cause what we call the beer belly. So they start to lose muscle tone and they start to gain fat, and then they start to have cortisol issues. So, when we help them with their testosterone, it's amazing how much faster they can lose weight. In women, it helps with sex drive and with conversion to estrogen. It helps with the vaginal dryness and things like that. So, and it helps with overall energy levels as well. In some women who have hormone imbalance issues, who are still menstruating and have conditions like polycystic ovarian syndrome or PCOS, well, they'll actually have too much testosterone, so they'll get acne and they'll get hair on their face and things like that. So there are ways in women that we can actually bring the testosterone down if we need to. DHEA is often a conversion hormone that converts into testosterone. So a lot of times when men have low testosterone, their DHEA will be low. And again, sometimes we can just recommend DHEA treatment instead of just testosterone, and the testosterone will come up. DHEA is really the hormone of libido or sexual interest, and so testosterone is kind of thought as the sexual interest hormone, but DHEA can really help with low sexual interest. Progesterone is the hormone that is sort of the mother hormone that converts into estrogens and testosterones, and it can convert to cortisol. And progesterone is the main hormone of sleep. So after menopause, when progesterone starts to decline, that's one of the issues that we'll see first is sleep issues, and then we'll see fluid retention, which progesterone also helps to regulate. So the optimal level with bioidentical hormone therapy is 6 to 8, and most women menopausally have a progesterone level that's almost non-detectable. Very commonly see like 0.8. So if your level is very low, we need to get it up to about 6 to 8. And then again, if you're still having menstrual cycles or you're pregnant, the levels will look a little different. And progesterone is thought to be the yin to the yang of estrogen in both men and women, and it helps keep the estrogen dominance balanced. So it must be in proper balance to promote mood, sleep, weight, and fluid balance. So if your hormones are out of balance, you can check the box here. I may need hormone therapy with E2, which is estradiol, E3, which is estriol, progesterone, testosterone, DHEA, or pregnenolone, or something else. So your provider may go through this with you or your coach. If your estrogen is high, you may need some DIM. If you have problems with high testosterone, saw palmetto is actually a supplement that will help your estrogen testosterone conversion. Men who have what's called BPH or benign prostatic hypertrophy, trouble with their urine stream, they may say that I used to could write my name in the snow and now I can't, may have some testosterone conversion issues, so we may recommend saw palmetto. But saw palmetto is not just for men, because men and women both have all the same hormones basically. Sometimes I'll recommend saw palmetto for women as a testosterone blocker. Estrofactors is a product from Metagenics that helps regulate the estrogen dominance, and it's mostly all herbal stuff, and I won't go into all the details there about estrofactors, but we may recommend that. Vitamin E also helps regulate hormone levels as well, especially if you have breast tenderness from too much estrone. I usually recommend about 200 IU to 400 IU of vitamin E a day if you have breast tenderness, especially after starting hormone therapy. And you may need cycloprogesterone if you're still having menstrual cycles or you have fertility issues. So we can talk more specifically with you about that if you're having concerns there. There is an OTC progesterone cream that you can use called Endo Cream. We use that sometimes, but I usually prefer just the convenience of using the prescription progesterone, whether we use a cream or we use the sublingual tablets. I've moved a lot to the sublingual tablets away from the bioidentical hormone creams just because different people absorb the creams differently and it's a little more predictable when we use the under the tongue. I try to avoid oral, especially or by mouth, where you actually swallow it. We call that oral. Testosterone, particularly because it's a little hard on the liver. We learned that through bodybuilders taking too much testosterone and it pretty much blew their livers out. So the sublingual goes straight into the bloodstream, the under the tongue, just like the creams would, but it's a more direct route to the bloodstream under the tongue. And we don't have to worry about absorption through the skin. Also, when you take a cream through the skin, there are different enzymes in the skin that may convert your hormones in ways that are either unpredictable or unwanted. So I like the sublingual tablets. So a lot of times we'll use our mail-off pharmacy that has wonderful formulations for the sublingual tablets. And we may recommend other labs if any of these labs are out of whack. Okay, so let's move on to the thyroid. The thyroid is basically the gland that regulates your metabolism, and the thyroid starts to go when the other hormones start to go. It's very common. Thyroid also is very susceptible to autoimmune disease. So when you have things like leaky gut or you have a lot of food sensitivities, gluten particularly, it's a protein found in grain, can trigger autoimmune thyroid disease, all sorts of autoimmune disease. But the thyroid is very critical for nutrient balance, and the thyroid also needs certain nutrients like selenium and zinc to help it work better, as well as iodine. So the thyroid is quite critical to have all the nutrients in place. And you can write in your TSH level. The TSH is the hormone that's made from the brain, from the pituitary gland, that tells your thyroid gland to make more or less. And so this is tricky. And this is something that even a lot of medical students struggle with. When the TSH is high, the free available thyroid hormone, or the T3, will be low, and vice versa. So if your TSH is high, that's when we recommend to usually use some kind of thyroid therapy. And the reference range is 0.4 to almost 5. And the American Society of Endocrinology has actually changed that range, and they've lowered it. They used to have it at 15, then they lowered it to 10, and now they've lowered it to 5 because so many people have thyroid issues. The problem with TSH is that when you take a synthetic like Synthroid hormone that's a prescription, it will suppress the TSH, and your body will think that your TSH is fine. And if a doctor just checks a TSH level, they may miss what we call subclinical hypothyroid or low thyroid condition, and under treat low thyroid. I usually like to see the TSH in the 1 to 2 or the lower range. The higher it is, the worse off your thyroid is, basically. So the TSH is a protein hormone secreted by the pituitary gland, and it regulates the thyroid gland. It's not actually a thyroid hormone, it just regulates the thyroid gland. And a high level suggests that your thyroid is underactive, and a low level suggests that your thyroid is overactive. You'll want to be cautious using iodine supplementation, because some people think, well, I'll just take iodine, that'll help my thyroid work better if you have an autoimmune condition, because it can actually, in the conversion process, can make things worse. And if people have autoimmune, it's really important to do the food sensitivity testing and see if gluten is a sensitivity for you, because gluten can stimulate something called zonulin in the gut. That's a protein that can block the thyroid conversion enzyme into its active form. And usually people with autoimmune thyroid, I'll put them on a gluten-free diet. So what is your T3 level? That's your free available thyroid hormone. The reference range is 2 to 4, and optimal is greater than 3. So, if you're at 1 to 2 on your T3, then a lot of times, even if it's quote within normal range, I'll give some prescription T3 or thyroid. I like to use a lot of Armour thyroid or MP thyroid because it has both T4 and T3 in it, unlike Synthroid, which is not only the synthetic form, but it's only T4, which can trick the TSH into thinking that you're okay. But if you look here, T4 gets converted to T3 by pulling an iodine molecule. We call it T4 because it has 4 iodine molecules. T3 only has 3 iodine molecules. And this peroxidase enzyme pulls an iodine off to make the active form. And so if you don't have this active form, you're going to gain weight, you're going to get constipated, your hair's going to fall out, you're going to have all sorts of problems. And here's the thyroid gland and the pituitary gland, and this is that feedback that happens between the TSH and the T4 and T3. So there are 2 types of thyroid hormones that are easily measurable, T4 and T3. We usually check the T3 level, and if you have autoimmune thyroid, we may check antibodies against your thyroid, we may check gluten levels, we may check other things, but this is just kind of the precursor hormones that we check. And then we also may do like T3 uptake and things like that to see how well your thyroid is converting. So if your thyroid hormone is low or high, you may need thyroid support supplements, and we can make those recommendations to you. You may need a low-dose thyroid prescription like Armour thyroid, MP thyroid, or we can do more sophisticated thyroid dosing where it's actually separated out into the T4 and T3. And sometimes when people aren't responding with Armour thyroid, I'll use either just T3 or I'll use a compound thyroid. I don't usually go to the compound thyroids because they're a little more expensive, and the Armour, the MP thyroid, usually works just fine. So, and the difference is that Armour MP is usually covered by your insurance, and compound thyroid is usually not at all. So that's a little bit more expense. So if the T4, T3, and Armour will work, that's usually where we start. If you have autoimmune, or if you have issues with conversion, then you need to avoid gluten products, and we can address that further. So you may need some further testing as well for antibodies or T4. And so, maybe your hair's falling out, maybe you're gaining weight, and I want to talk to thyroid just a little bit, as well as all the other hormones. There's what we call functional medicine or functional lab ranges, and you may fall into the abnormally low or abnormally high, and traditional medicine will usually address these ranges. But when you are somewhere in the middle, in the high or the low end, these are what we call the functional lab ranges that may need some therapy to help you if you're having symptoms. So let's talk a little bit about glucose metabolism. And a lot of doctors check glucose or sugar levels. And the problem with that is that you can have diabetes for up to 10 years before your insulin level starts before you actually have full-blown diabetes, or before your blood sugar goes up. So the pancreas, like any other gland that can get exhausted or fatigued, stops working. But when you have insulin resistance early on, your blood sugar will actually go low because your insulin goes up. So that's one of the things that we do is check insulin levels. And if you haven't eaten any sugar, which we call that a fasting blood level, then your insulin level should be very low. And if your insulin level is high, that means that your body is pumping out too much insulin inappropriately. So the reference range is anywhere from 2 to 24, but optimal is less than 10. So if your insulin is above 10, then we need to really start thinking that you may have metabolic syndrome or pre-diabetes, and we treat you just like you're a diabetic, not with insulin, because if we give you insulin, that will actually make you gain weight. So that's one of the problems I have with traditional medicine is when you get diabetes, they immediately just want to give you insulin, which is a sugar storage hormone, which then makes you gain weight. So we want to address those insulin levels early. And if it's greater than 10, there are a few different therapies that we can do. One of the most effective is to decrease your sugar or your carbohydrate load. And we've got videos on nutrition. We'll talk further about that. I usually recommend people keep their carbohydrates less than 100 grams a day. So if your insulin is normal, then carbohydrates probably aren't a really big issue for you. But if they're elevated greater than 10, there is a natural supplement called chromium picolinate that I really like. I usually recommend about 200 micrograms with meals, so that can be 2 to 3 times a day, and that can help your insulin regulate a little better. And there's a link there that you can order that if you want. And decreasing your carbohydrates to less than 100 grams a day, or 25 to 30 grams per meal if you're eating 3 meals a day. And just to give you a little bit of a reference there, a slice of bread is about 15 grams of carbs. So a sandwich would be 30 grams of carbs. So you add, some chips or, a candy bar or a soda, you can well get over, gosh, 500-600 carb grams in one meal. So even juices, fruit juices and things like that, which I never recommend if you're going to have fruit, eat the fruit because you have the fiber that decreases the glycemic index. But I really recommend that you get something like MyFitnessPal or something like that, or look online and calculate some carb grams, and your coach can work with you on that as well. If you have insulin issues, we really want to follow that closely so that you don't turn into a full-blown diabetic. And again, a lot of people will say, well, I have low blood sugar, I don't have diabetes. So if you've ever had low blood sugar, that is an indicator that your insulin is high or that you're insulin resistant. So something we really want to look at for keeping you healthy, because diabetes can start to affect your blood vessels. It can cause blood pressure issues, and people can start to have all the complications of diabetes, not to scare you, but amputations and all the scary things associated with diabetes. We may recommend that you do get a blood sugar level or something called a hemoglobin A1C, which is a 3-month sugar test, to evaluate what's going on further if you have full-blown diabetes or an issue there. So I want to talk a little bit about nutrition panels, and vitamin D is actually a hormone, but it is a hormone that is absolutely critical to your immune system and to help regulate your neurohormone chemicals that regulate mood, so your serotonins and dopamines and things like that. So a lot of times people with depression will have low vitamin D levels, and you're probably familiar with something called seasonal affective disorder. That's where you get depressed in the wintertime, and usually that's because the skin is vital for conversion of vitamin D from sunlight. So especially if you're somebody who tries to avoid the sun, your vitamin D levels can go low as well. You can write in your level right now, and the reference range is 30 to 100. Optimal is greater than 80. I very rarely see anybody come into the program over about 40 if they're not taking vitamin D supplementation. And it's critical that if you're going to take vitamin D supplementation, that you take about 5 to 10,000 international units of D3. And you can get that from Metagenics, but if you're going to get it like at the health food store, make sure that you get D3. Now, vitamin D is one of the fat-soluble vitamins. A, D, E, and K are all fat-soluble vitamins, so you can get too much vitamin D, so it is important to do regular monitoring. And the way vitamin D is converted is the sunlight on the skin converts your vitamin D into basically something called 7-dehydrocholesterol. Cholesterol showing up again as a precursor, right? Cholesterol is also a precursor to your male and female hormones. And then that gets converted to cholecalciferol, which then goes to the liver, and then the liver and the digestive tract also help. So if you have leaky gut and you have issues there, also when you take dietary intake and you have leaky gut and you're not absorbing your vitamin D, then it's not going to basically get into the system. So you have two different routes, the sunlight and your dietary intake. And then the liver metabolizes that into D3, which then the kidneys then clear. So if you have calcium imbalances, and estrogen helps regulate the calcium. Estrogen helps put calcium in the bone. So a lot of times we'll see D3 imbalances when people after menopause because of that reason as well. Also, if they're not getting enough dietary intake or they're limiting their sunlight exposure. And we don't want to get sunburned, so I'm not saying that you need to go bake in the sun all day because that can cause immune system problems that can cause cancer and things like that. But just 20 to 30 minutes of sunlight a day, and getting the adequate dietary intake. In the summer, I usually recommend about 10,000 or 5,000 international units of D3, and in the winter, increase it to about 10,000 international units of vitamin D3. So just a little bit more on vitamin D. We can get it through the skin, through the sunlight. And then some of the reasons that we have low vitamin D would be our cholesterol is too low. So if you're on cholesterol medications, that can lower your vitamin D. If you get too much sunlight, that can actually affect the process as well, or too little sun. The gut, if you are not taking in your vitamin D, if you have had your gallbladder removed or you don't have enough stomach acid is very important for helping you absorb your vitamin D, or low magnesium. And many people are low in magnesium, especially people with insulin problems, because insulin helps store magnesium as well. Or they take in excessive polyunsaturated fats, because when you take in the fats that aren't so healthy for you, the grease on the food and things like that, it competes for the other oils. If you have a lot of body fat, if you're overweight, that can affect your metabolism of your good fats and your vitamin D, since it is fat soluble vitamin. If you have too much fat, it can cause some conversion problems. If you take in a lot of toxins like PCBs, which are found in plastics, or DDT, which is the pesticides and things like that, can affect your liver, which then can affect your vitamin D conversion to your kidney. People who smoke also have low vitamin D and low calcium as well. And so if you are a smoker, which I hope you're not, or I hope you're working on quitting, you'll need excess vitamin D supplementation as well. And people who get kidney stones often have vitamin D deficiency, because then they have this calcium imbalance of too much calcium, and they'll get calcium stones. So if you've ever had kidney stones, it's very important that you get adequate vitamin D as well. And then there's some other paracrine systems like your parathyroid glands and things that help regulate calcium and estrogen, which can be affected too. And I don't want to get too complicated and make you think, oh my gosh, I have to know all this. Your provider and your coaches know these things. So it's just things that we're taking into account. But the more you know, the more you can be empowered. And then at the level of the cell, the vitamin D helps with your immune system, and it helps with your mood. So my husband, his sister just let him know. She lives in another state, and she's in Oklahoma, and she just got a diagnosis of cancer today. And vitamin D, adequate levels of vitamin D have been shown to reduce cancer rates by 70%. That's 70%. So, all these people with the cancer societies and things like that wearing the ribbons, I think they should put a picture of vitamin D on there, because it can reduce your cancer rate by 70%. It regulates your immune system, and more importantly, it helps you be healthy, and it helps with so many other processes as well. So we want to keep the magnesium. The omega-3s have lots of good fatty acids that help store this vitamin D as well. So all that takes into account. There's also a supplement called resveratrol that helps keep your vitamin D in cells. So if you have low-grade chronic low vitamin D, you may want to take resveratrol, which is also known as an anti-cancer supplement as well. So again, the vitamin D3 recommendations are 10,000 IU in the winter months, 5,000 in the summer if you're getting some sun exposure. And I love the vitamin D3 with K2, which is just kind of helps the absorption as well from Metagenics. There is a prescription vitamin D3 that you can use like 50,000 units a week. The problem with that is usually the pharmacist will just go get the over-the-counter stuff and hand it to you, even if you have a prescription. But sometimes, people who have really good prescription benefits or whatever may want us to write a prescription for vitamin D3. So, we do that sometimes. And again, we want to follow up at 3 to 6 months because you can get too much vitamin D. So we want to be cautious with that. Or we may do other tests like kidney function tests or other hormones like estrogen and magnesium levels or things like that to make sure, or calcium, make sure that everything's in balance. B12 is critical for metabolism, for energy levels. B12 helps hold oxygen in your red blood cells. And so if you don't have good oxygenation in your red blood cells will be big and fat and not have much oxygen in them, and you'll be tired. So B12 also helps as a cofactor for all your other B vitamins, which are critical for losing weight and for just upregulating your metabolism. So the reference range for B12 is about 200 to 1,000. And some people who have low stomach acid or they're taking PPIs or acid blockers like Protonix or Prilosec will have problems getting their B12 levels up because they can't process or absorb their B12. People who have candida or have insulin or blood sugar issues and have a lot of yeast, you need bacteria to break down your B12. So, and people who've had gastric bypass surgery oftentimes will have critical low B12 levels because that's the area of your gut that you need to absorb your B12. Sometimes we'll use a prescription medication called metformin when people have insulin resistance or glucophage, and glucophage can affect or lower your B12 levels. So if you're on any kind of therapy like that, sometimes we'll recommend injectable B12 or B12 shots or B12 injections or a sublingual form so that it's not critical for stomach absorption. And there are some different forms that are great from Metagenics that you can get as well. You get about 1,000 micrograms of B12 in your metabolic pack when you join the program. So that should be adequate for your B12 as long as you've got adequate stomach acid and things are working properly. Some people have a genetic condition where they don't process B12 well in the stomach. It's called pernicious anemia. And then some people have folate deficiencies and genetic issues with folate like MTHFR, which we may look at as well if B12 is a problem for you. So that's a little beyond the scope of what I'm talking about here today in this preliminary training, but B12 is critical for energy levels and for weight loss. B12 is basically taken in usually through the mouth into the stomach, and stomach acid helps break it down. So adequate levels of stomach acid is very important. So if you have issues with reflux and you're taking an acid blocker, we have a protocol for, it's a GI healing protocol to get you off those PPIs and heal this up. Traditional medicine usually wants people to go on those acid blockers because when the acid goes up and through the esophagus into the swallowing tube, it causes pain. Traditional medicine, just treats the symptoms, not the underlying cause. And the stomach acid is usually low when it's going up in here because maybe you're overweight and it's pushing the acid up. You actually need more stomach acid to close this little sphincter at the opening of the stomach. So our GI protocol, we actually give you more stomach acid. Some people take apple cider vinegar, but some people need something stronger like the hydrochloric acid tablets. Also, your gallbladder is essential for helping to break down fats and help process B12. So if you don't have a gallbladder, the GI protocol is very important as well to help with digestive enzymes from the pancreas and the proteases to help your B12 break down as well. So lots of critical things here in the gut. I don't want to overwhelm you with this picture, but if you have stomach acid issues or you don't have a gallbladder, or you've been diagnosed with something like pernicious anemia and you don't have enough what's called intrinsic factor to break down your B12, or you're not taking probiotics so you have too much yeast and not enough bacteria to help you process that, all of those can play into having low B12. Other testing recommendations that we may have made from the get-go or we may make from here would be genetic testing for B vitamin metabolism like MTHFR. I love 23andMe. It's a saliva test and it It checks for all the methylation and detoxification pathways or genetic problems that people can have. So we may recommend some of that testing. We also do nutritional hair analysis for 300 different nutrients, and we can tell you. I love that nutritional hair analysis. I think I'm pretty healthy, and I take quite a few supplements, not a lot, but things that I thought I needed based on occasional symptoms, and I came back with like 6 things that were low, including my vitamin E, which I had no idea. So I mean, that can be critical information to have, especially if you're trying to biohack or anti-aging and you want to be as healthy as possible. We can also do heavy metal testing, and hair analysis can also do food sensitivity testing as well, and it's a little bit more advanced, and it gives you a picture over time, because the hair is a longer indicator over time than just a blood test or even the saliva. We may do estriol testing. That's not very common because it's a protective hormone, but if you've had breast cancer, we may check for your protective estrogen to make sure that you have plenty of it. If you have acne issues or prostate issues, we may check a hormone called DHT or dihydrotestosterone, and make recommendations for people with things like PCOS and things like that. Pregnenolone is a precursor hormone that we usually dose pregnenolone because it is a precursor hormone based on age, but sometimes we'll check a level for that. Sometimes we'll check a blood count or your kidney or liver function if you're having issues and look at that. A PSA is a prostate-specific antigen, which can be a prostate cancer test. A lot of times primary care doctors will do those basic things like a CMP and a CBC and PSA. So we don't often do that, but we can do that as part of a more extensive panel to look at those things and make some natural recommendations or some integrative or holistic medicine or supplement recommendations. Occasionally we'll do stool analysis if you have issues with leaky gut or chronic irritable bowel syndrome, things like that, when we suspect parasites or things like that. We may do serial cortisol testing at 4-hour intervals if you have problems with your cortisol, or saliva testing for all sorts of different hormones as well. So those are just some more specialty testing that we can do. Just want to remind you that our metabolic pack that you get when you join the program has the bare minimum ingredients for metabolic processes. And so if we recommend something, we're recommending above and beyond what's in there, okay? So you should be aware that in our metabolic pack, there's 1,000 international units of vitamin D. So if your vitamin D levels are low, we usually recommend 5,000 to 10,000, so you may need additional. And the reason that I only put 1,000 in there is because some people are already taking supplementation, and vitamin D is one of the ones that you can get too much of. So I just want to put the bare minimum in there of vitamin D. There's a little bit of chromium, which can help with insulin metabolism, 200 micrograms. And people who have insulin resistance or metabolic syndrome, I'll recommend 200 micrograms 2 to 3 times a day or with meals, so you may need a little more of that. There's a milligram of B12, which is 1,000 micrograms, so that's usually adequate for your B12 needs unless you've got leaky gut or you're taking acid stomach blockers or something like that. There's also another B vitamin, it's B9 or methylfolate, and there's 100 micrograms of that in there. So if you have issues, genetic issues with folate metabolism or MTHFR, usually those people I recommend about 200 micrograms. So if you have methylation or detoxification issues, your coach or your provider may talk to you about doing that additional testing, and we may recommend a little bit more methylfolate. There's very minimal vitamin E, only 5 international units. If you have breast tenderness or estrogen dominance issues or anything like that, we recommend 200 to 400. So just enough vitamin E to kind of help all these other things absorb well. There's a little bit of iodine in there as well to help the thyroid work better. And if you have thyroid issues, we may recommend some extra thyroid supplementation. And then there's 150 milligrams of magnesium. Now, if you get too much magnesium, you can get some loose stools because magnesium will relax the smooth muscles in the bowels. Most people are deficient in magnesium. And if people have blood pressure issues, because it's just smooth muscle basically in the blood vessel walls. So if you have blood pressure issues or you have constipation or you have chronic headaches from muscle tension in the head, sometimes I'll recommend up to 1,000 to 2,000 milligrams of magnesium a day, so you may need additional magnesium. So with all this information, you can predict the future of your health. And so really, you just have to order the correct test, determine the true underlying cause, focus on the cause and not the symptoms, which is this pathway for understanding what's going on in your body, correcting the dysfunction, and don't just alter labs with drugs. If the cholesterol is high, there's an imbalance somewhere because cholesterol is your precursor to your hormones. So find the hormone imbalance and correct that. Address the body as a whole. You can't just look at an insulin level or just a TSH or thyroid level. You have to look at all these hormones together and take them into account. And then a systematic approach and mentoring. So your coach and your provider will work with you as well. And the more you know, the more empowered you are. So when we look at the hormones, basically, I like to break it down and look at the labs. And if you had a high, let's say high insulin level, then you can kind of know that this is probably more what your body type is going to look like. If you have thyroid, too low a thyroid, this is kind of what your body type will look like. Estrogen dominance looks like this. Cortisol issues look like belly fat usually. Testosterone issues will look like just kind of this isolated belly. So I think it's really interesting to be able to put your body type along with your lab test to more interpret and help us identify the area that we're going to target. The team that we have in place will review all of your hormones and will make a recommendation also based on your symptom sheet that you give them, whether it's anything from weight gain to hot flashes to not sleeping. And then all that into account will make a recommendation for your therapy. So what's next? Well, this information is so important for you to have and start empowering yourself, making your roadmap. And then the process is really just getting those things balanced and working with your coach and your provider, and then rechecking those levels to see where we're at to make sure that we're on the right track. And we incorporate what we call the biobalance system, which incorporates fitness and nutrition and stress and all those different areas to put it all together to really have a bio-optimized system. So I hope this has been very helpful for you. If you have any questions or concerns, you can let us know at info@betterlivingrx.com. And you can email me directly if you want to, Dr.Tammy at betterlivingrx.com. And love to hear your questions or comments. And hope this has been just amazing and a game changer for you. You don't have to have a medical education to understand this stuff, but these are things that are critical to your metabolism and the way you feel. So the more empowered you are, the more you know, the better off you'll be. So stay tuned. We've got lots more coming, lots of more educational stuff. And please schedule a visit with your coach as soon as possible so that you can review your worksheet and really dive into understanding these things. And it's kind of like drinking from a water hose. You probably feel a little overwhelmed at this point. So I recommend that you push pause, replay, listen to this again and again, and ask questions, reach out, let us know, so that we can really put a program that's individualized and designed to get you the best, most fabulous, amazing life ever. Blessings to you, and I'll see you soon.